me see. Go ahead, Tracy.
Hey, Tracy.
Hello, how y'all doing?
Still good.
So I have a friend that's got a pretty serious situation going on.
Mhm.
And she's down to 40% lung capacity. Her husband, she was in great health last year. She did 2 75 hard challenges, great health. Her husband had a stroke about 6 months ago or so, and he's gotten very quick and substantial memory loss. And so no, the doctors don't see anything wrong with her heart. And, I'm sure there's more tests ahead, but they own a horse farm. So what I think is she's got tremendous stress, fear, heartbreak, and especially fear of abandonment. And I was thinking that maybe the respiratory kit and maybe some sort of
Okay,
heart song.
so let me just ask a few questions.
Okay.
So she's down to 40% lung capacity is what you said.
Right.
And was she diagnosed with asthma,
No.
COPD?
I don't know if they've gotten to that point yet.
Okay. And so they haven't looked at COPD and they haven't looked at emphysema or anything like that.
Right. And really, unless she's breathed it somewhere she's worked, she hasn't done any, she hasn't smoked or anything like that.
Hasn't smoked, no known exposures to asbestos or anything like that.
No.
Okay. So here's my hesitation is with emphysema, if that's what it is. Does she have a big history of smoking or anything like that?
No, not at all.
Okay.
But she might have had a parent that smoked when she was a kid.
Yeah. With emphysema, when you increase oxygen levels in the lungs, it actually causes them to go into a crisis.
Really?
And so, yeah, it's a really tough one to treat. And so everything else, you can do some sort of treatment. Emphysema is one where somebody has to really have some chops to treat it. Like, you know what I mean? It's even physicians wise, you got to be real super careful, because you don't want to throw them into a crisis.
Right.
And so, and there's no cough or anything right now. It's no chance it's a whooping cough or anything like that.
I only talked to her for a brief time today, and I could hear her voice was very like sensitive, like she was talking very low, and you could tell it was laboring her to talk, but she never coughed, and we talked for 30-45 minutes. So I think she would have coughed during that time.
When you were talking to her, did she gasp for air? Like as she was talking, did she from time to time go?
No, she didn't. That's the interesting thing.
Okay.
What does it mean when you do the like you just did?
It's called aerophagy, and it just means gulping of air. And so it's tension with like nervous tension with like highly overactivated fight-flight response. And so usually there's anxiety that goes along with that. But if you notice, like sometimes people with anxiety will be doing something and then they'll take a big long breath, a couple times an hour or something. And so it causes some digestive issues because they are taking in a bunch of air through their mouth. And so it can cause like bloating and things in the gut, but it's also reflective of the nervous system being agitated, the adrenals being agitated, and needing to balance the autonomic nervous system.
So that's me. I've noticed I'm doing
Oh,
that.
you do that? Start with anise, like take a few drops of anise internally, then inhale Lang, about 15-20 inhalations, and then go to the bronchial blend or the basil clove. something like that, because you want to slow down the respiratory rate, and then you want to start to relax the smooth muscle of the respiratory tract, especially the bronchioles and the lung tissue. And so that blend bronchioles was actually made for that, you know, but you still need to, like, inhaling ylang ylang reduces the rate of, like, it stops you from breathing really fast, like, you know, having short, rapid breathing. Spikenard can be used that way. Valerian can be used that way. In a pinch, vetiver might do it, but I usually go to ylang ylang or spikenard.
Okay,
But the anise internally starts to balance out the sympathetic, parasympathetic. And
Okay.
so it's not so much about pulling the person out of fight flight, but just balancing out the two sides. So for you, that's what I would do.
okay,
For her. So right off the bat, she's got some huge cords to her solar plexus. So you can do that with Rue, or you can do that with things you know with pH. They're very big.
what was the one you just said after Rue?
Rue, or what you know with chronic heating, pH.
Oh, good.
They're big. That's probably why she's having that difficulty. But still, after that, I'd clean things up. If that's the case, I'd rotate between hyssop and Palo Santo, using Rue to disintegrate the cords. But once things are cleaned up, you're going to have to clean up the solar plexus. But I'd still like to address lung function somewhat. I would probably go, you know, how we just talked about the bronchioles for you. I'd probably use that for her. And then also the Breathe Easy, which has a strong anti-inflammatory effect. And for her, probably spikenard as well, inhaling, and just have her just keep rotating the three of them. And for her, put spikenard on her feet, you know, like a lot, like, you know, 10, 12 drops each foot. Like when there's cords, or when there's pain, or when there's like high levels of stress, it heightens the amount of like stress response and lower emotions that get generated. And spikenard to the feet is a way to calm that down pretty quickly.
Okay,
Yeah. I suspect that cutting the cords of a person will substantially reduce the issue.
okay. Yeah,
She's
the
got
other.
them,
was
she's got them under basic as well. Basic, spleen, front back solar plexus is really bad. And the crown, the top of her head.
basic spleen.
Yeah.
Yeah, she just started also going back to being a real estate broker, and I kind of pace,
It's somebody close to her.
you know, she's got a lot of stuff.
Yeah, somebody in her periphery.
Okay. Thank you so much, Greg.
Yeah. If for some reason that's not resolving it, I mean, there could still just be a good old fashioned, you know, respiratory issue. And when you see like that much of a reduction in the breath, you know, she has recently had COVID.
I don't know.
Okay, that would be another question I would ask. The doctor probably asked her, you know, because the issue with some people that have had COVID is some of the respiratory function doesn't quite recover even after the virus and the illness goes away. They're still left with this like kind of respiratory distress. And some of it is a little bit of like scarring in the lung tissue, which is, it's not like cuts, it's just like fascial lesions. You know, it's like spasms, but not in muscle, but in like connective tissue.
Right.
And so it can be that, it can be poor circulation to the area, it could be inflammation. Um, uh, yeah. You know, whenever I see a reduction of lung function like that, I always look at the diaphragm, muscles in the neck. You know, like she would be a good candidate too for potential paradoxical breathing, which, you know, it's like the breath gets flipped. Like, so when you inhale, your abdomen usually goes out. With paradoxical breathing, when they take a breath, the abdomen goes in. And so it's like their breath gets actually flipped, and that wreaks havoc on the nervous system, like havoc. And so that needs to be resolved. And that could be due to stress. That could be due to like anxiety, difficult situations. Could happen from cords. Could happen from a lot of coughing. You know, like if she was sick or something like that, or like choked on something and was trying to cough it up, something like that. But muscles in the neck, particularly the scalenes, you know, those really deep muscles in the neck,
Oh, yes.
when they become contracted, they elevate the rib cage, the first rib, and they are usually the primary reason for paradoxical breathing.
Okay.
You know, and the way to check her on that, like there's just a really quick way to do it is, see how I take my fingers and like if I turn them to the side, see how I can bend and touch, like bend them and they're touching the top of the palm itself like that. You see how I'm doing that?
Yep.
If her scalenes are the issue, when she bends, she'll go like that.
Oh, okay.
She won't be able to touch. Like,
That's interesting.
like if she goes like this and like the middle finger does that, that's just a muscle in the forearm and not an issue for respiratory issues. But if she can't get all of her fingers to touch, that is scalene involvement.
Thank you. I've never heard of that test.
Yeah. Oh, every time there's usually anxiety or something like that, that's when I would treat people in person. That's one of the first things that I would do is like, let's just check for paradoxical breathing right off the bat. Yeah.
I still want to take your training for therapist
Yeah.
class.
Yeah. You know, I don't know if there's the trigger point stuff that's on on websites and things, but the hardcover, just old school, those 2 volumes of the trigger point anatomy, it's basically a physician desk reference. It's they use it for injection sites, but it has all the like the symptoms and secondary symptoms that come along with the trigger point activity and like what to look for and how to test. And so if you go to Travell, yeah. Their books are expensive. Like, you know, the 2 volumes are probably $250. But they do make a digital copy, but I found that the digital copy didn't always have all the information. You know, like the old school versions of the hard copies. I actually prefer those, and that's a true. I have both, but most times if I'm traveling, I use the digital copy. But when I'm at home and I'm looking something up, I go to the old books. Yeah.
They've been on my wish list for a long time.
Yeah. Sometimes you can buy them used on Amazon. If you keep watching for them, you can find them sometimes for about half price.
Okay.
Yeah. I'll keep an eye out for you too, because those are good to have. You know, I've a couple of my physician friends, I used to buy them and give them to them for Christmas or something. You know, it's usually not something that a physician has unless they're doing pain management or something. But I always thought it was interesting information for them to have in case they were trying to troubleshoot something. So.
Oh yeah.
Yeah.
Thank you.
Yeah, you're so welcome. Actually, we should get some of those for Joel. Yeah. I might be checking Amazon too. We might have somebody do.
Uh-oh.
Don't check for like a week and let me go check.
You know, I'm gonna go check right now, right?
Yeah.
Thanks, Greg.
Yeah, you know, we were talking about like doing a trigger point class. You know, I don't know that the general public would find it interesting, but therapists and stuff, healers would probably find it interesting. But it would probably have to be in person. You know, it would be hard to do over Zoom. Just
Of course
because
it
you're
needs to be
talking-
in person.
What's that?
I said, of course it needs to be in person. How are we
yeah.
gonna
It
do
would
it?
be a hard one to teach via Zoom. I mean, it's a bunch of technical information. It would probably have to be a series of like 5 or 6 classes, but
Hey,
depends
I'm-
on how in depth you wanted to go. I taught it one time. I taught like like one version of it actually in San Diego, but with energy healing instead of with oils. But yeah, it's complex. You know, it's well, I mean, you know, if you do trigger point stuff, it's
Hey, everybody listening, tell
Yeah.
Greg you want that class, those
Yeah.
classes.
we don't realize how much neurological dysfunction comes from the skeletal muscles. You know, keeping muscles healthy and loose and functioning right reduces a lot of weird symptoms that can happen in the respiratory tract, digestive tract, urinary tract, you know, just in the nervous system itself. Even brain function and mental faculties are impacted by trigger point activity. But, you know, maybe we can do it like in a study group thing where we just do a series of them, like a free study group or something. It's probably for most people would be a little bit boring, but you know, it's a lot of symptom looking at symptoms and then having to, you know, evaluate and treat. You know,
Yeah,
anyway.
I'm up for it.
Hmm.
Hopefully lots of other people will be too.
Yeah, we could try to do something with it.
Thanks, Greg. I really appreciate it.
You're so welcome.
I'm feeling a lot better too, by the way. And
Oh, good.
I actually spent some time in the woods this weekend and did not get overheated. And so things are.
So
a lot
you
better.
are improving?
Yes, I am. Thank you.
Okay, good.
Everything you said was perfect.
Okay, good. Yeah,
Thanks.
good.
Go ahead, Chris.
Hey, Chris.
Hi, Greg. Good afternoon.
Hey. So
I just wanted to.
how's your
Pardon?
recovery? How's your
It's
recovery?
it's going fantastic. I want to say it's on track, but actually it's ahead
Yeah,
of schedule.
That's what we always
So
like to shoot for. Like being ahead of the curve.
there you go. So
Yeah.
I just wanted to call and give you that update, but actually for yourself and for everybody on the call, just rave about that the post-surgical oil kit that you sent. When I received it, still had the bandages off. They came off on the 31st
Right.
on my follow-up. So in the meantime, I was putting the helichrysum and the blue healer ointment on the areas outside of the bandage, especially in the black and
Right.
blue area. And then after the bandages came off, obviously could start putting it, you know, closer to the incision points. And I want to say that even before the bandages came off, that whole glute area probably reduced 40 to 50% of the
Yeah.
black and blue coverage. And then
Yeah.
and then when
Perfect.
the bandages came off, I mean, the black and blue was gone on
Yeah.
5 days after that. So there's no more
Yeah.
black and blue even on that
Yeah.
glute.
Which is super fast. Like for that kind of surgery, the black and blue can last for quite a while. And so the incision is closed and you're starting to put the helichrysum directly on or close to the incision site? Or-
Yes.
Perfect.
There were 2 incisions. One on the glute itself is the longest one. That's probably about 6 to 7. And then there was a smaller, I want to say 3-inch incision up along the waistline. So yeah,
Right.
I'm putting it very close to the incision and probably give it another week to really heal up
Right.
and then start applying to where the incision is.
Yeah, that will so cut down the amount of physical therapy that they'll have to do for the scar tissue. Like if you just keep doing that, when the time comes, they'll probably evaluate it and just go, you're fine.
Yeah.
You know, they'll have you do some other things, but as far as, because that friction massage, you know, all they're doing is they're irritating the area to get blood to go to that area, and it's really flippin' painful. And so the more you can avoid that, the better. But now, if you reduce the scar tissue with what you're doing, even if they do go ahead and do the friction massage, you've broken up the scar tissue. And so it just feels like a vigorous massage rather than pins and needles going back and forth and getting irritated. And, you know, because it almost, it's not tearing anything, but it feels like tears, you know, when if you've ever had it done. It's really super uncomfortable, but, you know, that's the way that they used to break up scar tissue is, you know, they would do that with some hot packs and, you know, sometimes they go back and forth with hot and cold, but a lot of times it's hot packs and just, you know, going like against the grain and just trying to irritate it as much as you could to get blood to it. And so, plus it increases range of motion, reduces pain, it allows for greater mobility and things like that. And so, yeah, you know, the goal is to get about 80% of the swelling down as quickly as possible. You know, the other 20% takes several months, but that first wave of reducing swelling, usually that first 80% takes about 3 months. But if you treat it like how we're talking about, a lot of times it will reduce in maybe half the time. And then that last 20% reduces like with movement and stuff. You know, you'll just, you know, as the more you move and kind of do things, it kind of goes away. And as you get your strength back, it goes away. But any sort of surgery, you know, usually the first 3 months is 80% of the swelling, and then the last 20% takes another like 9 months. And so if you can get ahead of the curve like that, it reduces it and makes you more comfortable and more functional. And you know, the more that you can walk on it and do stuff and not get super fatigued or super irritated or anything like that, the stronger that becomes. And you know, you just shake off the surgery and move forward.
Yep.
Isn't it nice not to have that deep pain in the hip socket?
Oh, yes. Yes.
Yeah. Yeah.
Notice,
That's a game changer. Yeah.
Yeah. Notice that when I first woke up and they tried to get me on my feet, it's like, oh,
Yep.
that pain is gone.
Yeah. It's like there's the pain of the surgery, but that pain that's always there is gone. Yeah.
I did have a follow-up question.
Sure.
Just on the energy level, I noticed that I'm, you know, probably be expected with, you know, just not even 3 weeks out from the surgery, but I notice I'm, you know, getting very tired during the day.
Yeah, that's kind of normal.
Okay.
You know, normally I would say like do a little cinnamon or a little, but with that, I mean, you probably could, you know what I would probably have you do is, I would actually probably do, there's this herb called rhodiola.
Yes.
I would probably actually put you on rhodiola.
Okay.
Very good, it's very strong. It really helps a lot with when you're starting to have fatigue a little bit later in the day, like post lunch. You know, say
Yes.
you start having fatigue at like 2 o'clock, 3 o'clock, and you still got a few hours to go, but you don't want to use some sort of stimulant to push you through. Rhodiola is really super good for that. You know, and there's two kinds. There's like a Tibetan version and a regular version. Either one, doesn't matter which one, but I would do 2 or 3 capsules, you know, like maybe at lunch or even a little bit before that. You could even take it right as you're getting fatigued, but it will take about, you know, 45 minutes or an hour to kick in. So I'd probably take it at lunch, and that should help you finish the day. And you know, you still might be a little tired just because your body's recovering, but you wouldn't be super tired. Like, you know, you'll just be like, yeah, you know, I'm getting my legs back and everything, but that fatigue that comes in about 2 o'clock or so, rhodiola is really super good for that.
Okay. And I believe we have some in the house, but I know it's
Oh,
easy
perfect.
to get easy enough to get a hold of it at most
Yeah.
places. So
Three capsules is pretty solid, and even if you need to bump it up to like 4 or 5, I mean that's doable. But 2 or 3 should get you. Like I would probably do 3, and then eventually maybe work your way down to 2. As your energy levels improve. But having diminished energy levels for a while post surgery is pretty normal. Yeah, super normal. And the reason why I didn't want to do cinnamon, or like you could do thyme. You could do softer forms of thyme, but just wanting to keep you away from like heat, like anything that generates heat, because you already are dealing with an inflammatory response in the body and you're reducing it. And then to throw something in there like that, it would probably be okay. But I would like it better if there was just no need for the heat. In a month's time, I think it would be fine. But for the next few weeks, I think rhodiola, it's softer. It still works really well. It'll give you some strength and allow you to sleep at night. It's not overstimulating. The other one that I kind of would use from time to time in a situation like this is ashwagandha. Ashwagandha would help increase energy levels, but would also improve you going to sleep at night. And so it could be used, but with the fatigue coming on at the time of day that you're talking about, rhodiola is like your go-to thing.
Okay, perfect. And just one more brief question. Sorry, I lied. I know a lot of people. Any of the oils that I've been taking internally, or even the topical ones from the surgical kit, would any of them be considered a diuretic?
Let me look at this. Tell me what's in the surgical kit. I have to look it up.
The Helichrysum Supreme, the Blue Healer, the Vetiver ointment, and then Black Seed and the Galbanum.
Galbanum, I mean, a little bit, but nothing massively. Things like lovage, parsley, juniper, things like that would be much stronger diuretics. I mean, there is a little bit of some diuretic effects with some of the things on there, but they're so mild that a lot of times I wouldn't even consider them a diuretic.
Okay.
Are you having to urinate a lot?
Yeah, especially like I sent you a separate email, and I know you probably get a lot of them. But anyway, it's usually between the time I go to bed, say 10 or 11, and about 5 in the morning, I end up having to get up at least 3 times and go a significant amount. And I don't.
Try doing this. Do you have any saffron? Do you guys have saffron?
I don't. I'm not sure. I'll have to check.
So it's a little bit expensive. If you have it, let's use that. And if you don't, let's not have you get it. But sometimes saffron will help calm down the nerves of the urinary tract. And so if you have like that urge to like frequent urination sometimes, it can calm that down. I would say it works about 70% of the time, but you need to take, like, you can inhale it, but it works best for that when you take like a drop or 2 internally. And you might not even need to do it more than a day or 2 in a row, and it might just like knock it out.
Okay. Perfect.
Yours is probably tied more just to the surgery rather than, having whatever issue. But like if somebody had like a reaction to medication, or if they just had that, sometimes as we get older, you can start to have that need for frequent urination. And one of the ways to calm it down can be the use of saffron. A softer version of it is like chamomiles will sometimes work, but cypress actually can work sometimes, but sometimes they're not strong enough. And so I go to saffron. Like if I use saffron, like say, like, a bigger dosage than that, because it does things for the brain and for intuitive thinking and things like that. Sometimes if I take kind of a big dose, I won't pee for a really long time. Like, it's that calming to the nerves. And so, which is not good. Like, but a drop or 2 should be fine.
Okay. Well, thank you so much, Greg. I appreciate all your inputs. Thank you.
Glad you're doing better. Yeah, good.
Go ahead, Ralph.
Hey, Ralph.
Hey Greg, how you doing today?
Hey, I'm doing pretty good.
Excellent. I did a blood test a while back and for the doctor, and she noticed that my thyroid numbers were just barely into the high side.
Barely into the high side.
And so what I'm looking for is, do we have an oil that will normalize thyroid activity?
Yeah. Your best bet, like sometimes pine can work.
Mhm.
I've had some luck occasionally with myrtle, but the thing that I would probably have you do as a go-to would be clove oil. And clove
Okay.
oil needs to be a drop or two in water and then taken internally. Be sure to mix it with water, but
Right.
do it
Oh yeah,
with
I know about clove.
daily. Yeah. It's a strong one, but
Yes, sir.
that should actually help to regulate the thyroid. If it's
Okay.
too low or too high, the clove oil usually will regulate it.
Okay. Cool.
Yeah.
Thanks.
The other thing to always keep in mind too is if it's not responding too well to that, is you want to look at like treating the whole endocrine system, because the endocrine system is very complicated. There's so much communication going on between the glands, and so you could use something like lemon verbena or the quiet mind, which is a blend to kind of do that. Lavender complex, which would be a whole kind of endocrine like tonic. But at first I would just go for the clove itself. And then if it's not responding well there, still continue with the clove, and then, reinforce it with lemon verbena, lavender complex, or the quiet mind, which would be an overall treatment.
Yeah.
The other one it's trial and error with the endocrine system, because it's not the same for everybody, because our glands are doing different things.
Yep.
And so sometimes you just start treating and there's not really a clear like path for this condition, you do this condition, you do that. You just start like doing this dance and just trying to regulate it. And so the other one is mixing frankincense and myrrh together will sometimes have an effect on the hypothalamus, which then starts to impact the thyroid and the pituitary, and there is this like
So that we put 1 drop of each in water and do that internally?
yeah, you mix them together, or 1 drop of each, and then just mix it up and then drink it.
Yeah.
But there's an axis for the hypothalamus, pituitary, and thyroid, and then one for the hypothalamus, pituitary, adrenals, and then hypothalamus, pituitary, and gonads. And so sometimes when it's not responding to the regular treatment for the thyroid, then you look at the overall effect. This is at least the way I approach it.
Yeah.
Look at the overall endocrine system, and then if it's still not responding, then I still keep treating the thyroid, and then I go to the hypothalamus as well.
Okay.
And so usually within there, you kind of get it, unless there starts to be some significant issue with a gland. But if you're just like starting to get out of the parameters of normal function, and then also a little bit of you said you're too high or too low?
High.
Too high.
The numbers were high.
Yeah, like so I would stick with that. Like try doing that, and then you need to treat it for a little while, but it won't be an instantaneous shift. But you should start to notice something within about 30 days or so.
Okay. All right. Cool. I'll let you know.
Okay. Good.
Go ahead, Barbara.
Hey, Barbara.
Hey there. This isn't my question yet, but I flunked the scaling test in my right hand.
Your scaling's on that side, or and all fingers, or one finger didn't go all the way down?
The only one that goes all the way down is my ring finger. And it's probably has something to do with this tight thing down the back of my neck that's been there for months and has become the new me.
Yeah. You like the bronchial blend, the like hyssop, larch, inhaling that a lot, and then putting marjoram or even the trigger point blend on the side. But like, you know how there's the muscle and then the collarbone, and then there's that kind of like indention that's not really muscle, but you can stick your fingers down in kind of a little bit deeper.
Yep.
Like rub some of the marjoram or the trigger point blend like in that area and try to get it like, you know, deeper there. And then inhale, like after you've applied it, inhale the hyssop or the larch or the bronchioles. And it should, over a period of time with a few treatments, start to unwind that,
Okay, so
the scaling muscle.
a few times a day, ideally.
Oh, if you can do it that much, I was, you know, even if you just do it once a day, that would be great, but just do it
Okay.
several days in a row.
I meant the inhalations, but
Yeah.
a lot, but the
Yeah,
topical application once or
yeah, yeah. Both the inhalations and the topical, like once a day, is pretty solid.
okay, thanks.
Yeah, yeah.
And the
A lot of
question-
people have that issue, by the way. Yeah, it's just sometimes the rib, also the first rib, possibly potentially is elevated as well, but you still can relax the muscle even if that rib's elevated.
I think it gets a little relaxed, and then the way I sleep, it just
Yeah, that could be the way you sleep,
knocks it all
or it
out
could have
again.
been an old injury.
okay.
Yeah.
So the question has to do with the amazing class we did this weekend.
Oh yeah.
And I wrote to Samantha and said, whatever you unleashed, the activity that goes on in my head at night is now on steroids. And I've been waking up with just really head congestion and feeling just kind of off. And I indulged myself time-wise the last couple of days, but I cannot do that tomorrow morning. So I'm
Right. So one of the things that you can do, like the head's getting congested. One of the things that you could do is,
I think there's a lot of energy coming in overnight.
yeah, and your endocrine system, because of what we did, it impacts the hypothalamus quite substantially, and so it literally is changing your brain somewhat and changing some of the nervous system and lower emotions. And so I would say a lot of cleanup on the arms and legs would actually probably make the head a little bit better.
Okay.
And so use something like Chocolate Root Cleanser or hyssop or Palo Santo on the arms and legs. You know, you do the joints or you know, put it in lotion and rub it all over the arms and legs.
Okay.
And that should actually be enough.
Great.
Yeah.
Thank you.
You're so welcome. And let us know, like within 24 hours, if it's not better, like, or getting better, let us know so we can take a next step.
Okay. Thanks.
Okay.
And go ahead, Robert.
Hey, Robert.
Let's get you unmuted first.
There we go. Sorry about that.
Hey,
I was busy typing, not paying attention. I was up next. I have a client. She's about early 60s, postmenopausal, complaining of dry vaginal area. And this is acute, recent.
Yeah. So couple of things. I would put her on anise or anise, like a couple of drops internally in water, just to balance out the nervous system. And then you can put her on some Vitex, you know, like a drop or two in the temples on a daily basis, for just balancing out the hormones and you know, if there's lack of or too much, it tends to balance out the estrogen and progesterone. But the other one would be Shazandra, like taking Shazandra internally, a couple of drops at night before bed would help her sleep better, but it also helps to convert the water in the body and moisten like the mucous membranes and you know, lining of everything, including in the vagina. And so when there's a bunch of dryness like that, I usually do at least the anise and the schizandra, but sometimes I also put them on the Vitex. So
Okay.
that
Excellent.
usually will resolve it. That usually almost always resolves it.
And how long does it normally take? 30 days?
You should probably notice a difference within a few days to a week, but I would say treatment probably needs to be a good 30 to 60 days just to help regulate the body. There might be a little bit of a hormonal issue that's fluctuating. And so if it's hormonal, it will take a little while to have the body regulate. So usually if there's some sort of issue that's either chronic or involves the endocrine system, I usually treat it for a good 60 days to establish a new pattern in the body and then start backing off to see if it needs continued treatment. Where like other things you can treat it, and if it starts to get better, you go, yeah, we can call it good. Endocrine system is slow to start, doing something, and it's slow to stop. And so if you are starting to make a shift in it, you have to treat it for really quite a while before that change like integrates.
Okay.
Yeah.
Excellent. Thank you.
Yeah, you're so welcome.
And go ahead, Megan.
Hey, Megan.
There you go.
Sorry, that went by faster than I expected. I'm gonna try to squeeze a couple questions in if I possibly can. One, I think these are easy. I am trying to work on my gums. They've been very receded for many years. They haven't gotten worse, but I really like to just try to grow them back. I'm going to the dentist. I don't want the lecture again. They want to do a graft. I don't want to do that. I looked at the chronic healing protocol on Marilette's group, and I wondered if I could do something stronger than this. It just said to clean, sorry, it's a pH question that people, clean with green and violet, energize with green, blue, violet. But what about delicate regeneration or using red? Is that possible?
Usually it's because of inflammation. And so I would probably stick with the green, blue, violet. And then oil-wise, try gargling with cypress, and then even taking a few drops of cypress and rubbing it directly on the gums.
Okay.
Yeah. The cypress is incredibly good for the gum tissue. And so like I've had people that their gums have gotten so inflamed that the gums get kind of spongy and the teeth even start to get like kind of loose. And I'll have them start putting the cypress on, and it firms the tissue up and reduces the inflammation because it's detoxifying the gum tissue. And so what happens sometimes is we'll get like a lot of stagnant lymph, but in the gums, the roof of your mouth, things like that. And so it helps kind of clean all that up and firm up the gum tissue as well.
Okay. How many times a day can I do this?
You could do it morning and night. I mean, you could do it more than that, but you could do it in the morning when you get up, and like do it after you brush your teeth, and then at night after you brush your teeth.
Okay, thank you.
Yeah.
And then, so I know it sounds like a dumb question, but I've called all the holistic dentists in my city to see if anybody will support doing anything for cavities besides fillings. I hear stories online of people that have at least partially regrown teeth. And if the tooth is a bone, my question is, can you regrow that?
I don't think it's possible. Like it's like a fingernail. It's like dead tissue.
Really? Okay.
Yeah. Are you worried about the mercury?
No, I have a mercury-free dentist. It's for
Okay.
my daughter. She has a huge number of cavities. I don't know why. My son doesn't have any, and I'm like, what's going on? And I just feel bad, so little, to put her through that. So I'm just researching.
Yeah. I mean, sometimes it can be like bacteria and things in the mouth. And so like have her start doing a little bit of a gargle. I mean, you could even have her do the cypress. It's not a super strong taste. And so, she can just do like a little mouth rinse, and you could even take like some of the little kid mouthwashes and add a bunch of cypress to it, and then shake it up, and then give her like a little cupful and have her just really swish it around.
Okay.
That could still be helpful. Yeah.
Okay, thank you.
yeah.
And then last, I have a client with Lyme, or she believes she has Lyme. I think she's gotten some different opinions, and at least one practitioner, I think she said, if I remember, does agree with that. She also has Epstein-Barr and just years of fatigue. She said even as a child she had issues with fatigue. So I mean that's the background. But is there an oil that could knock out Lyme disease?
It would be a very complex approach. I mean, because like, I mean, you're kind of even nailing it with what you're saying is like there's Lyme, there's potential Epstein-Barr. It basically, a lot of times the diagnosis is based on a series of symptoms. And, you know, yes, there's some testing and everything, but still it's not as clear cut as it could be. And so you're dealing with inflammation, you're dealing with really stagnant lymph, you're dealing with overactivated sensory nerves, you're also dealing with brain fatigue. And so it is usually a pretty complex approach. A lot of people who get diagnosed with Lyme, you know, I'm not always sure that it's Lyme, but it's a lot of those conditions look very similar. And so treatment form is very similar. And so I don't get too caught up on, you know, what the diagnosis is. Like usually when they present with some of that, I just start going down the road with that. And so forms of time are very good. You want to clean up the lymphatic system quite substantially. And so,
Girl on her own. She's actually really into essential oils, so she's ordered some of
okay,
it.
so have her clean up the lymphatic system quite substantially. Need to calm down the sensory nerves, which would, you know, like vetiver or Spanish sage, even tarragon might work, but something along those lines. And the brain fatigue really needs to be addressed.
Okay.
And so like if the brain fatigue doesn't get addressed, you'll get some of those other things to start to be better, and then they go back to being bad again. And you know, because the brain isn't functioning as well. And so, you know, things that are strengthening and fortifying to the brain, rosemary, basil, petitgrain, you know, cinnamon.
Yeah, I have the sleep and memory. I've done that a lot on myself, so I like.
Yeah.
For chronic brain fatigue, would you do delicate regeneration or just clean and energize the brain?
I usually clean the lower centers. A lot of times I don't even go to the brain. I clean up the lower centers because if you look at them, they're depleted and super congested.
Okay.
But clean that up before I even go to the brain.
Okay. Thank you.
Yeah. And then with that, after that, just like a bunch of green and violet in the brain.
Okay.
Yeah.
Thank you.
You're so welcome. Keep me posted on that. That can be complex. You know, you'll have to keep changing treatment a little bit as the body shifts and changes, but it's treatable. It's just it takes some constant effort for a while.
Yeah.
Yeah.
Thank you.
You're so.
Go ahead, Zakia.
Hey, Zakia.
Hi, Greg.
Hey, how are you?
Hi, Sam. Hi, everybody. So I have two questions.
Mhm.
Last week was my first week back to work after the surgery.
How's all that going?
Everything is going great. The rehab is great. The physical therapy is great. But for some reason, I can't seem to get the stiffness out of my joints. I'm 4 months out
All
and
the
I've reached the
joints?
point that I don't think it is physical. I think there's a block in my energy. Somebody put a lock on my aura. No matter, and it's just my knees are so tight. And it's not pain, it's just stiffness.
Just stiffness. Is that all your joints?
No, the knees from
Just
the
the knees.
surgery, because I had the knee
Okay.
replacement in one knee.
Okay. But
But in
both
the
knees, so both knees are stiff.
Yeah, and the surgery knee is like incredible. And like I still can't go up and down stairs without a cane, and sitting and standing is just like horrible. And it doesn't seem like it's physical. I'm beginning to believe that there's some block on my knee, some energy or something.
How long ago was the surgery?
November.
Oh yeah, boy, that's
Yeah.
a while.
Yeah,
How swollen are they?
they're not. That's the other part. There's no swelling or clear inflammation in that sense. There was, of course, in the first 2 or 3 months, but 4 months out, no. But it's just stiff as all hell.
Okay, and other joints, are they achy as well?
No, my shoulders are killing me because I'm walking with the cane. I did some months with the
Right.
walker, but no, all other joints are fine.
Is your skin itchy?
Only just beginning to itch where the scar is, but not other than that.
Not other places, just where
No.
the scar is.
Yeah. And I actually started doing chronic healing this week because it doesn't appear to be physical. You know, I take the pain medication they've given me. I take Tylenol, and the stiffness is just incredible, and it doesn't appear to be going away. And that's what made me think it's not physical.
And the head is clear, like your thought processes are clear, and you're not like struggling to form thoughts or.
I had a teeny bit of aphasia and a teeny bit of fogginess within the first, I would say 3, 4, 6 weeks, but now
Okay,
I'm normal.
That's kind of normal.
Yeah.
Okay.
And I started doing chronic healing this weekend because I can't figure out anything physical.
What's your sleep been like?
Fine.
You're falling asleep okay? You're staying asleep through the night?
No problem. Never had a problem with sleep. Except the pain when I bend my knees. But other than that, no, I sleep fine.
And you have a little bit of shoulder pain.
Yeah,
Is
that
the shoulder
is
pain like
easing
right
up
up in
since
here?
I've using since I stopped using the walker and I used the cane less. I have
Okay.
less shoulder pain. It's
Is
now
your
it's
shoulder
just,
pain like right up in here?
yes.
Okay, so couple of things. You have a little bit of what we call like your body's flexor dominant, and that can happen when there has been inflammation in the body, which for you was a surgery.
Right.
And so what happens is your extensor muscles kind of lose their tone when there's the inflammation, and then when the inflammation goes away, the extensor muscles start to gain their tone back. But in that time frame where the extensor muscles lose a little bit of tone, extensors and flexor muscles like balance each other. And so if
Right.
the extensors lose their tone, it throws the flexors into not
Spasm?
spasm, but like tension. Like the tension increases quite substantially.
Right.
And so then when the extensors regain some of their tone again, the flexors are already in spasm and they have a hard time like balancing out. And so that will make some of the joints really stiff, and you basically have a little bit of in the shoulders, it's bicipital tendonitis. So it's the bicep here, but the tendons are up here, but that's like your arms going like this would make
Yes.
it feel, yeah. So you could do a couple of things. Like one is like deepening the breath, but I would almost do like inhalations with like something relaxing, like spikenard or valerian, even helichrysum. Just inhaling it through the nose.
Okay.
That will start to help. But you also are going to want to put something that's antispasmodic on the biceps and down the hamstrings and then down your shins, right? And so the one that I would probably go to would be some form of pepper, like black pepper, pink pepper, white pepper, some sort of pepper. If you don't
Okay.
have that, some marjoram, some basil, petitgrain, something that's antispasmodic.
Okay.
And again, rub it on the hamstrings and on the shins,
Shins and biceps.
and then the biceps. And the biceps, like here, like you can kind of see, like here's where my arm like bends,
Yes.
like just slightly above that is where you're going to get it. So I would probably also do some inhalations with ginger. Like I would take a lot of long, slow, deep breaths with ginger. I'd probably take some ginger internally as well, be it herb or.
I do it every day. I take ginger for my general, I've always had inflammation problems.
Okay,
I
so
take that every
maybe
day.
bump up the ginger a little bit, or
Okay.
do some inhalations with it. The
Will
reason
do.
that I like the ginger for inhalations for something like this is when inhaling, not when taken internally, but when inhaling, sometimes it will calm down some of the trigger point activity.
Okay.
And so you're going to have, because of the tension in the flexor muscles, you're going to have some trigger point activity there. After you've done that for a little bit, I'd rotate what you're putting on the hamstrings, the shin, and the bicep, and I'd go to something super anti-inflammatory. Like I'd go to something that's like a dark blue color, like German chamomile, yarrow, the dark tansy, something like that, and rub it on the flexor muscles. And so I'd rotate that back and forth a few times, and it probably will resolve it after you've rotated through it a couple of times. It will
Okay.
probably resolve it. The other thing that I would do is the chakra root cleanser, like on the joints, just on all your joints. Because that's, for one, your arms and legs look congested, but I think it's because of the flexor domination. When you become flexor dominant, your arms and legs just get super congested. And so you do have a lot of energy congestion. You can go through and clean those out, but the chakra root cleanser will help clear that out. And in it, there is kunzia, in the blend. And kunzia is very good for increasing flexibility. We have people who use the chakra root cleanser like in rehab and like physical therapy kind of settings. And it does increase range of motion when it's being used. And so I would dab it in the joints. And if you don't have that, use the kunzia by itself. Like I would use the blend just because it's got mugwort in it, opens up the channels, that kind of
Yeah,
stuff.
have chakra root cleanser.
Yeah, then just dab it on all the joints.
Okay. Okay.
That combination over a period of time, it's not going to be an overnight, like, I got it, but you should start feeling better. And then within a week or two, even better. And like, as you kind of keep rotating through it, you should keep feeling better.
So when you say alternate, we talking about alternate one day, every day, morning and night? What's
Yeah,
the
I would
routine?
probably do the first time around, I'd probably do like the pepper or the antispasmodic for a few days. And then after a few days, I'd switch over to the anti-inflammatory for a few days. And then after that, one day one, the next day the other. One day one, the next day the other. But the first few days, do 2 or 3 days deep on one, and then the other one, 2 or 3 days deep on the other.
Okay.
Yeah.
Thank you. I have a second question.
That should knock it out.
Thank you. Thank you. It's been so horrible.
Yeah. Knees are a little bit, it's a harder surgery to come back from. The joint for the knees is a little bit more complicated than the hip. It's an odd joint because it's just two bones stacked on top of each other, where,
Right.
the hip's a socket, where the knees are just stacked,
Right.
and so you're prone to more myofascial kind of issues with knee issues.
Right.
Yeah. So
Right.
yeah.
So my second question, I have a new client,
Mhm.
very much like Robert. Oh boy, she sexual abuse as a child.
Mhm.
She's plus 60, very vibrant young woman.
Mhm.
But her issue, she had therapy as a child, she said was not helpful. She says, so my initial thoughts to begin, I suggested, a blend of Cariol, Taminu, and calendula with a few drops of helichrysum, spikenard, and lavender. But she
Mhm.
says there's itching, there's a lot of itching, there is scabbing, and her vagina is closing. If she goes to massage and just try to put her finger, and it's very painful.
Yeah. So part of what happens sometimes, especially with the abuse, is the muscles and the floor of the pelvis will actually tighten up and even develop trigger point activity. And so it's like right at the floor of the pelvis. And so with that, there can be a lot of like clamping down and things like that. The helichrysum was pretty solid, like having her inhale it even would be helpful. But I think at this point, do you have large?
Yes.
So I'd have her inhale large, and I would actually even give her a couple of drops of large and have her take that internally. And the issue being that it will relax certain parts of her nervous system to allow that part of the pelvis to unwind. Now, the other thing that I would take into account is Vitex, helps to regulate the menstrual cycle and the monthly cycle and everything. Hormones that are too much or not enough. But one of the things that Vitex is also good with is actually helping to resolve abuse. And so it can be something where it actually has a little bit of like a psychological cleansing of, because it's a lot of times it's lower emotions, like it's unconscious, and the Vitex can actually be kind of good for that. It's slow. It's not like it's, boy, take it a week and boom, I feel good. It's like, using it every day for a couple of months, there could start to be a difference. That can be helpful. That with the larch. I'd still probably continue a little bit with having her inhale the helichrysum. I mean, I think that could be good. I'd almost like her to like inhale helichrysum and have her awareness on the sex chakra itself.
Okay.
And then have her put mugwort on the joints of the arms and legs.
Okay.
Because that's going to allow for, the arms and legs are extensions of the basic chakra. And so when you're dealing with like old forms of abuse or just a lot of like stress or lower emotions, the flow of the lower emotions to be transmuted to higher emotions and then eventually like released or something can be inhibited by blockages in the arms and the legs, different than like what you have with your arms and legs, because
Right.
yours is more being flexor dominant and everything. This is more of like it becomes a little bit of like a circulatory issue and just energetic congestion. And so when you open that up, it allows for some emotions to flow a little bit more, and there can be a reduction in the clamping down in the pelvis. Now, if like you're doing all of this and it's just like it's just not working, a go-to thing with blockages in the pelvis is sandalwood. Like
Okay.
sandalwood, regardless if it's about abuse or if it's an injury or if it's just like blockages in the urinary tract or lymphatic vessels and things in the pelvis, whatever it is, even in the veins, sandalwood can be very helpful. It would need to be internal. Like,
Internal.
yeah, topically won't cut it. Like it, I mean, it kind of helps, but it needs to be like 2 or 3 drops a couple of times a day, and it will open up the pelvis.
Any particular sandalwood or anyone?
I would use genuine sandalwood for that versus like golden sandalwood, where the other sandalwood is the speculatum. It's real similar, but it would probably work, but they're so close on price that I would just go for the golden old school sandalwood.
Okay,
You know, because there's variations of sandalwood these days, and so
Right.
the golden, or the album is the old school sandalwood.
can you conceive of the vagina opening back up, or is that not a
I
what?
think I think you have a couple issues, but
Yeah.
if you unwind some of this, I've had it reverse.
Okay, okay. And should she, because I told her that she should seek adult therapy.
Seek what?
She said she had therapy when she was a child therapist and it didn't work.
Oh, yeah, that could be helpful. I mean, it depends on where she's at with that, but I mean, some of it is like a muscle memory. Like, I mean, she
Oh.
literally has muscle memory in her body. That's the clamping down and all that.
Oh, okay,
Yeah, like the things that we talked about should start to address that.
okay.
Yeah.
Thank you so much.
So sometimes with muscle memory, another one to throw in the mix, like the larch should do it, but hyssop inhaled can also unwind some of the muscle memory, and so you could try that. But I find larch actually is a little bit stronger for that.
Okay,
Yeah,
thank you.
very common, by the way, with abuse. Very common.
Okay.
Yeah,
That's
like
the first I've heard of that.
the pelvic floor, it's almost like a protective mechanism that happens, and that area just starts like clamping down, and then it just never stops.
Oh, and so would spraying maybe helichrysum lavender hydrosol, or is the oil a good approach?
Most of it's going to be either inhaled or taken internal.
For the best results.
Yeah. I mean, you could put some down there, but like the larch internally, and then inhaling the larch with her awareness on the sex
Sacral
chakra.
chakra, yeah.
Yeah. That should be helpful. And then the Vitex, a couple drops and have her put it on the temples. The reason to put it on the temples is it also directly impacts the hypothalamus, and so you're helping to regulate some hormones. You're helping to unwind the pelvis. You're undoing some muscle memory, and also helping to break loose the mind of the being stuck in the trauma.
Uh-huh.
Yeah.
Is it okay? Thank you.
When somebody really has a hard time, like maybe breaking out of the trauma, you can use cypress or eucalyptus, even hyssop, basil, like inhaled if they were to think about it. But if that doesn't work, some of the approaches are more expensive oils. They can just use a little tiny bit, but things like poplar or saffron, something like that, inhaled, but like a lot, will help break the mind out of the loop of the after effects of the trauma.
Right.
Yeah.
Thank you so much.
Yeah.
You mentioned to Megan cypress for the gums. Is that
Mhm.
better than clove?
Clove is more antibacterial and it's pain relieving. The cypress is a little bit more detoxifying, cleans up the lymph a little bit, and firms up the gums. So it would depend on what you're trying to do with it. If you have a little bit of infection or there's pain in a tooth, clove would be your go-to thing.
Okay.
But, we've been seeing a lot more of like stagnant lymph in the gums, and especially on the roof of the mouth, what can make you like gag real easy, like when you're brushing your teeth or something.
Right,
It starts to be harder for you to like not gag yourself as you're brushing your teeth.
right,
That a lot of that is lymph on the roof of your mouth.
right. Well, thank you so much. It's so good
Yeah.
to hear your voice and see
Yeah,
everybody's
good day.
face.
Yeah, I'm glad you're doing good.
Yeah, it's
Yeah.
been a while. Thanks so much.
Yeah. We'll
Bye,
get you kicking
everybody.
field goals here in no time.
Thanks.
You bet.
And go ahead, Megan.
Hey, Megan.
Hey, do you have a suggestion for keratosis pilaris? And myself and my son. In his case, he has like skin-colored bumps on his face. The doctor said it's not eczema and it's just a buildup of keratin. In me, I've always had it, and it's not really like bumpy, but it's like little spots on my arms and legs.
What is it? What is it?
Keratosis pilaris.
Oh, keratosis. I know I have something in my notes about that. I just have to think of where. Let's see here. Let me try looking that up, and we'll send you an email. Like, I would just be guessing off the top of my head. I know I have some notes for it, but it's probably going to take me a little bit to find it.
Okay, thank you.
All right, we have some things here in chat.
Mhm.
Well, I have a question on incense.
Mhm.
You can either unmute yourself or you can type it in. Yeah, go ahead there. Perfect.
Hey, Greg.
Hey.
I have some questions on, I wanted to geek out on product questions with you. So first
Sure.
of all, what would be a good incense to burn during like work hours? So my day is almost back to back with meetings during work hours, and I'm often having to step in and out of different, like there's a lot of context switching. So
Okay.
depending upon which group I'm meeting with, which team, there are different levels. So there's
Right.
quite a bit of context switching. And then in between meetings, I'll sometimes schedule like focus time where I get through like my emails, and then I do like a little bit more deep thinking. So as you know, just day to day, there's no 2 days that are alike. But what I'd love to be able to do is just be a little bit more fluid and more just something that'll kind of keep me in the flow, even though there's a lot of context switching, I guess is the way I could describe it. So I'm just wondering, I thought maybe I could, so what I do every day, my diffuser is working whenever I'm working, and I switch between Palo Santo, CRC, Hyssop, and
Mhm.
what else do I use? I love using Splendor in my diffuser.
Mhm.
But I
Right.
thought maybe incense would be fun to kind of use.
Like all of those are pretty solid choices. The one that I might throw into the mix, like not really be a replacement for any of that, but would be absinthium.
That's so great, because I actually had a little asterisk to ask you about
Yeah,
that.
I would do absinthium, and the reason being that like absinthium is very good for like contemplation and reflection and like thinking something out, like that kind of stuff. It's not necessarily like a brain stimulant, but it it kind of it can kind of be a way of like calming everything down so that you can think clearer, you know, if that
Nice.
makes sense. And so basil is always a good stimulant for like thinking things out, but like you're going from situation to situation, and you know the tendency is you know, we go from situation to situation, and sometimes some of the previous situations will kind of almost overlap into the new, like you go from one meeting to the next meeting and it almost like overlaps a little bit. You know what I mean? Like you're
Yes.
still a little bit like the ideas and the thinking. And so, you know, I remember having a conversation with Imaho when I was real young. And we were talking about this one tendency that I have. And I was like, oh, you know, I'm trying to overcome it. And he goes, don't try to overcome it. He said, temper it. Like be able to use it and then step away from it. And, you know, he might have been talking to me in French. You know, I was like 25. I was like, I have no idea what you're talking about. But over the years, you know, there is that thing to where, you know, you kind of give completely or fully into a situation. And then when you're done, you walk away and you can talk about something completely different and not drag a part of this in with into the next situation, if that makes sense.
Yeah,
Like,
it totally makes sense.
And so absinthium kind of helps with that. I find the Taiwanese cedar helps me with that a little bit as well. You know, do we have that blend attachment? Is it on the site?
I have that blend.
Yeah, you try using that blend as well, because part of it is just like your ability to disentangle and then go to the next piece. Hyssop could potentially work there, and then the other one that could potentially work there is that blend Padmasambhava.
Oh, I don't have that
Yeah.
one.
Yeah, Padmasambhava is about disentangling. You know, it's like that's what that blend does. And so I would imagine you're probably pretty good with it, but like the times sometimes where it might be a little bit of an issue is when you get fatigued.
Yep.
And so if it's when you're fatigued, then start looking at like using a little bit of thyme, a little bit of like basil, even Ravensara. Ravensara, like a few drops internally, can raise your energy levels without being like stimulating and just help you to go from situation to situation. And
Okay.
so if it's fatigue oriented, do something to strengthen the mental body, like the basil, the Ravensara or thyme. But if it's just a lot of information and you get a little bit entangled because there's so much mental activity and you got to go into another one and drop what you're thinking about and think of something completely different. I mean, in a way, you're multitasking. And so your ability to like detach from it and let it go, completely walk away from it, and then grab something else really is tied to higher creativity. And so, yeah, Padmasambhava, absinthium, hyssop could do it potentially.
I use hyssop every day in one
Yeah,
way, shape, or form,
for
every
the
day.
workplace.
Yep.
For the workplace, hyssop is, you know, it's got to be part of your survival kit. It just does. Yeah.
I work from home though. However, I'm still, you know, diffusing. hyssop
You're
all
still,
the time.
it's still, you will still absorb stuff from other people, even if you're not on Zoom or on a phone call, you're still having to interact and direct on a project. So there's still some sort of a connection, and it just helps you not absorb the stress and negativity from other people.
Yep,
You
that's
know,
that's so
yeah.
true. That's so
Yeah.
true. So I just want to double check.
Mhm.
The absinthium, I can get the incense form, right?
Yeah, do it in an incense. That's what I kind of use the absinthium for when I burn the incense, is for contemplation.
Okay.
You could diffuse it as well, but I like the scent of it when it burns.
Yeah, me too. I love it.
There's a little bit of something different when you burn it as an incense. You know, it has a little bit of a different effect on the energy body. It's a little bit more cleansing because of the fire.
Yep.
And, yeah, it's quite nice. I mean, we get up in the morning and with our morning coffee, we burn incense every morning.
Me too.
Just to shake off the sleep and then help clear the mind and contemplate a little bit of what we're going to do in the day or in the week. And, you know, we like burn some incense and do that. And sometimes even a couple of sticks and then boom, go do the day.
Yep. And then for the, when the mental body is a little fatigued, you mentioned use thyme, basil. Is that the
Basil
oil?
is basil oil. Like
Okay.
take the basil internally.
Take it internally, and then the Ravensara also internally, but not the
Yeah.
thyme, right?
Yeah, Ravensara would be more for the body fatigue. The basil would be more for the mental fatigue. You could add rosemary into the mix for the mental fatigue, but just body fatigue, like your body's tired, Ravensara.
Okay, got it. Great. Can I ask another product question? A little
Yeah, of course.
geek out moment here. What is the difference between a spray and a hydrosol that's on the website?
I
Give me
think
an
the
example.
hydrosol we have is the Roman chamomile hydrosol. Am I right?
Yeah, so spray has alcohol in it and some essential oil as well, and the hydrosol is just it's
Okay.
the water that they use to distill the oil. So a hydrosol, I usually don't add extra essential oil to it, even if I, you know, some of the things I use, I'll do hydrosol and add essential oils to it.
Okay.
But a hydrosol, like the Roman chamomile, I think we started doing it actually not with the idea of doing a product for the thing, but we had Samantha using it, like spraying it on her face and her eyes for when her eyes would get fatigued from looking at the computer.
Oh, is
And
that
so
what the
cover-
hydrosol was for?
Yeah, like
Okay.
I'd have her spray it on her eyes and just kind of rub it all over her eyes, and it takes some of the eye fatigue away. And then I think somebody was asking about it, and so we threw it up for that one person, and then we just left it on. You know,
I think
I
that's
didn't
very
really
nice.
have, I didn't really have the intention of putting the hydrosol on there, but I think we have it. Like I buy a gallon or two of it for using it around the office here for Samantha and the employees and stuff. And so, that's what we use it for.
Would it be okay if I ordered one?
Yeah, I think it's on the site.
Yeah, please do.
If not, just email us. And I have
Oh.
several hydrosols. I use them to make things.
Nice.
Plus, I also drink the hydrosols.
I love putting the
I'll
poplar
make up a
spray.
glass of the hydrosol.
Yeah, I love just spraying
Yeah,
the poplar balsam spray directly into my mouth when I wake up in the morning.
yeah.
Okay.
Oh, that's a nice one.
I do that like every morning. It's like become a ritual. Before the coffee
Yeah.
goes down, it's like a spray of poplar balsam just straight.
Nice.
I have another product question. Is that okay?
Sure. Yeah.
The Alchemy of Materialization Kit. Super excited that I found that on the site. I have a question. There were Grounded was an oil that was in our class kit, but it's not
Mhm.
in the actual kit on with the
Yeah.
roll.
So there's the 12 alchemy oils that we put in the kit,
Yep.
and then Grounded was already on the site, and so I guess we could put it in there. We made it more just for like that last thing. You could use Grounded. You could actually use other oils for materialization. Like we
Okay.
kind of talked about it. Yeah. So you don't have to necessarily use that, but those 12 are the ones to use for.
Okay, perfect. That's fine. I have Ganesha I can use for that
Yeah,
grounded.
perfect. Yeah.
Okay.
perfect.
All right. And then
We left it to be a little bit more flexible so people could use in that last one whatever they want.
Ganesha.
Mhm.
So if it's okay, I have another product question.
Sure.
I am about to step into this learning period. I have to focus on getting a certification. So it's,
Mhm.
I want to be able to study for it. So what can I use to help me with focus study? So basically my goal is, what can I use to help me step into a zone and where I can actually experience learning as a joy, as opposed to, oh, I have to do this, but it's like,
Right.
I want to just embrace the material, absorb it, not be so ADD about it. And then just, really enjoy the learning process. And just wondering if there's any guidance you can give me on what oil to use.
Okay, there'd be a couple of things that I would do. So one, still going back to the basil, the rosemary, even petitgrain for brain function. If there is some fatigue, some thyme or cinnamon taken internally in water could be helpful with that. I'd be careful with the cinnamon at night because it might keep you up. Thyme probably wouldn't, but cinnamon, if you did it like at 9 o'clock at night, you probably wouldn't fall asleep. If you did it during the day, it would be fine. But like too late, it's not that it's stimulating, it's just that it makes the body so strong that you don't fall asleep because you're tired, you know? And so there's that. But on the flip side of it, I would say jasmine. And jasmine is very good for fatigue. It's very fortifying. It's calming and soothing, yet fortifying at the same time. And it can help you be like a little bit more like playful with things that maybe are difficult or you don't like. And it increases, just by using it, it increases confidence levels. And so sometimes when we're having a little bit of difficulty with it, it could be that we just don't like the material, or because it's new, it's an unconscious thing, but we don't quite have the confidence level yet until we start applying it and having experiences. And the jasmine makes you like a little bit more playful about it, and just makes you kind of play with the information and just kind of have like more confidence, like, yeah, I'll work it out, I'll play with it, I'll figure it out. It kind of bumps up your confidence levels just by working with it. And so inhaling it, putting a little bit on the heart is good. You can put it on the temples. I like to put it on my feet. Like I put jasmine on my feet quite often. I think I was telling you guys, sometimes we're out in public and people will look to Samantha and go, "You smell really good." And she'll go, "Yeah, that's him," because jasmine's, a little bit of a sweet flowery smell, and they don't expect that to be coming from me. But, it does work for that.
Okay.
Yeah, it does work for that.
So there are two options on the site: Jasmine Absolute and Jasmine Sumbak.
Sumbak. The Sumbak is a little bit sweeter. They're both pretty solid. I usually use Sumbak myself. I mean, I go back and forth, but Sumbak just has a little bit more of a sweeter smell. The Absolute has a little bit more of a heavier scent, and so both are real solid though. Therapeutically, they're about the same.
Okay. Is there going to be a jasmine incense in our future, Greg?
Wink,
wink.
Probably. Yeah, probably. Yeah, I actually had talked about making that a couple of weeks ago.
All right, great.
Yeah.
That was it. And thank you so much for
you're so
this
welcome.
class. And also thank you for finding that chord, OMG. After that, it was not the person I thought it was. It was somebody different, and that person disappeared. I'm like, wow, that was incredible.
Yeah, good.
So thanks for finding that.
You're so welcome.
Thank you, Sammy.
Welcome. And that is our practice session for tonight for this part. If you took the Alchemy of Materialization class, we sent a separate link to you all if you'd like to join us next for a special Tuesday practice. Check your emails if you can't find that. I think, might have gone to spam, but this is it for that. But again, if you took this last weekend's class, the Alchemy of Materialization, we'll go into a deeper practice right now.
Yeah, we're going to start doing some different things in the next slot, and sometimes it might be from the previous class or some old classes, and still doing angel stuff. And so we're going to post what we're doing each Tuesday night.
And don't worry for you guys who've been hanging on and are going into the next one as well. We'll give you a second to find the link. I don't have it right offhand. So, all right, see you guys. And we are doing a special Astara blessing of the bowl here in a minute as well, after that session. So at 8:15 to 8:30, if you'd like to join the ministers of Astara and do some extra special healing blessings, we'd love for you to join us for that. I put the link in the newsletter for that one.